Here's another email from one of our viewers. This time it's from Madeline. Madeline asks, my son was recently diagnosed with idiopathic scoliosis. His doctor said that he has a curve of 37 degrees and he wants him to begin wearing a brace. My son is pretty upset about having to wear a brace because he thinks the other kids are going to make fun of him. I'm so sorry. That's terrible. And I'm sure a lot of kids feel that way. That said, does he really need to wear a brace at this juncture? Madeline, thank you for sharing with us the story. Unfortunately, due to the severity and the timing, it may be reasonable to consider a brace, but keep in mind that a brace is only effective if it's worn at least 20 hours a day. So if you think that that's going to be an absolute impossibility, it'd be good to have another discussion with your doc about whether it's even worth it. Living with scoliosis is not a sentence. So remember, this is not something that's dangerous or scary, but it would be worth it to get a second opinion. Bracing, if your growing child is going to go through the growth spurt, it may be reasonable. The brace tries to hold the body in a stable position, but again, the relevance of bracing is with the amount of hours of use. In the past, casting has been tried as well. Obviously, you can't take the cast off, and it really commits somebody to a treatment. Casts also have to be changed every 2 to 3 months. So again, not a minor procedure. And then finally, surgery. Despite everyone's best efforts, some curves do progress. And there is a significant argument about addressing scoliosis where there's clear evidence of progression. Now, the way that surgery addresses scoliosis is with something called a spinal fusion. There are actually a few other methods, but the spinal fusion is the most common. So in this approach, as you can see here in an X-ray, a curved spine is exposed, screws are placed into a curved spine, and then rods are introduced that are bent in only one plane. So the rods are introduced at an angle, and then they are rotated to provide a sweeping, immediate correction to the spine. Spine then appears much more straight, but that segment of the spine will lose motion. Now, a fused spine is not a normal spine, but if that means that we stop the progression, which may have its own deleterious effects, it's a reasonable thing to consider. Usually, there's going to be about a 6 to 12 month recovery period after surgery. Many of these kiddos will then need rehabilitation, physical therapy, and there are repercussions long-term as well. As you lose motion in that large segment of your spine, other discs see more stress, and we do see a significant number of patients, as many as 10%, come back with problems above or below. Physical therapy has been tried, and physical therapy may be beneficial in the hands of some providers. I personally am a bit more skeptical, but if a child is not in pain and you see a mild scoliosis, you may want to reconsider whether therapy is even reasonable. I would rather my kid play sports, and please don't worry about things like having a child wear backpacks on one side or slouch. The reality is we have great studies where kids with scoliosis were tracked for years and years, and we just do not find that these type of asymmetrical activities produce worsening of scoliosis.